How's everybody doing on their course point exams, course point quizzes? All done. Yay, 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 yay. Yippee, yay-o, ki-yay. All righty.
Yeah, I
Wow.
went through and everybody who was showing complete in course point, I went ahead and put it in Blackboard. So if
Okay.
you're done and it doesn't say you're done, let me know so I can double check.
Yeah.
But
In Farm 2, I had a couple of issues with it not showing up complete. So
yeah,
if you're having trouble, just reach out because other students have reached out to say that they are complete, and sometimes Course Point, like any other platform, has its glitches. So let us know if you're struggling with that as well. So let's just go over a couple of notes on upper respiratory, and this will certainly knock out at least this part. Certainly, upper respiratory and lower respiratory um, drugs are prolifically used by many people. Certainly, there's allergies, there's asthma, there's COPD from a variety of reasons, whether they're environmental, like um, working in a coal mine, um, um, being a painter, occupational hazards, to recreational things like smoking, etc., that are going to weigh in heavily on the taxing of the respiratory system. Upper respiratory, of course, are those that are associated with coughing, decongestants, antihistamines, and those sorts of things. Um, and what is an antitussive? What is an antitussive? I mean, these are over the counter. Absolutely. They're associated with cough suppression. Um, they suppress the medullary cough center in the brain, and certainly it acts as a local anesthetic on the respiratory passages, lungs, blocking the effectiveness of the strength receptors that stimulate the cough. So basically, what it does is it kind of numbs the cough center so that the coughing doesn't become an exaggerated activity. I've had friends that were coughing so much that they basically got a headache. And one of the symptoms associated with the pandemic has been cough. And, certainly all of us have been asked 1,000 times, have you had a cough lately? Or chest pain from coughing? Absolutely, for sure. Sometimes you tax the intercostals just from the coughing process. Um, Decongestants are drugs that cause local vasoconstriction. Adverse effects, certainly prolonged use of decongestants cause rebound vasodilation, and certainly chronic rhinitis. The reflex reaction to vasoconstriction certainly can result in the rebound through prolonged use. One thing to remember, there's also a um, nasally applied decongestants. When teaching, comment I would make on any nose drops or any nose sprays is that always get your patient to blow their nose prior to initiation of a nasal drop or a nasal spray. Basically, it clears out the sinus passages and allows for the more effective inhalation of the medication. Certainly, nasal steroids block the inflammatory response. Anytime you hear a steroid, the term steroid, or a any sort of uh, epinephrine, which is a steroid, has a steroidal effect, you always know that it works by decreasing inflammation. And that's basically the gist of using any nasal steroid or any other steroid for that matter. Um, there are also therapeutic actions associated with antihistamines. What's an antihistamine? It blocks the histaminic response and it relieves the symptoms associated more or less with seasonal um, allergic rhinitis, even conjunctivitis, and like itching eyes, um, angioedema. What are some of the antihistamines that we use very frequently? What's one that is we're just use even to put our kids to sleep? Absolutely, Zyrtec, Benadryl. Yeah, Benadryl is something that you'll actually see used a lot over the counter. It's even given, to any sort of allergic response to, um, I don't know, injection and redness on injection sites. So that's something that is, certainly very easy to grab, and very very effective for a variety of allergic responses. An expectorant, anaphylaxis treatments as well, absolutely. An expectorant would, of course, would be that drug that you take that would stimulate secretions. It's basically given for the symptomatic relief of any sort, right, absolutely, guaifenesin, any sort of um, where you need relief from a non-productive cough, when you can cough it up, helps you to cough it up for sure. But the guaifenesin, Michelle, that's certainly close enough. Guifenesin. It's kind of a hard one to spell, that's for sure. Um, and certainly those expectorants stimulate secretions to be productive. Mucolytics, of course, break down mucose and allow for the relief of respiratory in respiratory patients. So it helps them cough up the thick, tenacious secretions. Um, and certainly in older adults, of course, overuse of these medications can cause adverse effects or paradoxical effects. Um, Older adults are more than likely to have renal impairment and certainly could interfere with metabolism in excreting of these drugs. Anytime you have the fringes, the very young or the very old, usually the doses are tapered, um, related to either underdeveloped um, metabolism, metabolic processes, or worn out metabolic processes. Um, and sometimes these over the counter expectorant upper respiratory drugs, should be used with caution in any patient that have compromised immune systems and or any sort of chronic um, organ damage, lungs, kidneys, liver, etc. So there's really not much as far as those things that we need to talk about, especially for the exam. There are some questions on the lower respiratory tract. Um, TB is one of those such drugs. Does anybody know what is the drug that you'll take for TB or you'll give your patient for TB? Yep, there you go. Rifampin as well. Rifampin, there you go. What's one of the side effects of rifampin that is um, expected, but is sometimes alarming to your patients? Orange pea, absolutely. Any sort of bodily secretions can be orange. Um, and so when we're talking about drugs that affect the lower respiratory tract, we're talking about those that treat COPD, asthma, mostly asthma, particularly in the cases of the exam questions that we'll be referring to. One of uh, the most used drug for asthma is a short-acting beta agonist, albuterol. It um, it is one of the most popular and most used asthma drug, basically because it's short-acting, and it's one of those go-to drugs that usually will abort asthma attacks. Um, Oh, there you go. There you go, Saba. Learning sim today. That's cool. There's also long-acting beta agonists. One of the long-acting beta agonists that you will give as well and see on your exam is salmeterol. Did y'all talk about salmeterol today? Um, okay. What is one of the side effects of salmeterol that you might have discussed in sim today? Any takers? Thinking. There you go. That's okay. So basically, salmeterol, what it can, well, that's albuterol. Tachycardia, Millie, you have to check for these short-acting beta agonists because they do jack up the heart rate. Um, in fact, when you're giving these medications, typically, you're you will take respiratory rate following following application of these short-acting beta agonists. Also, interestingly enough, on the short-acting beta agonists, like particularly albuterol, when you're giving your patient these inhalers, these meter dose inhalers, you're going to ask them to hold their breath so they can hold in the medication. It acts quickly. But as far as the long-acting beta agonists like salmeterol, one of the side effects is thrush. That's why after a lot of these, you use spacers with these metered dose inhalers, and then you also get your patient to rinse their mouth after application of these inhalers. Yep, there you go, rinse the mouth. Absolutely. Sympathomimetics, of course, those are medications that dilate the bronchioles and add a depth to the respiratory rate or to the respiratory effort. I mentioned a steroid, epinephrine is one of those sympathomimetics. Certainly, it's a steroid, but it acts to dilate the bronchioles, and it also decreases the release of the inflammatory mediators. Epinephrine does. Typically speaking, it's one of the drugs that if you work in the ER, you'll give for patients that come in having asthma attacks. We will also go in depth in pharm 2 on steroids, and this will be a little bit of the conversations that we'll have. Anticholinergics, of course, also affect bronchodilation, but it does so because it affects the vagus nerve to relax the bronchial smooth muscles. So that's just a little bit of a different influence on dilating the bronchioles. Of course, I mentioned again, steroids do decrease the inflammatory response. So that is actually one of the mainstays in the treatment of asthma. Surfactants are those that decrease the surface tension in the alveoli, forcing them to expand. You will probably um, hear more about lung surfactants when you take your OB course, because one of the things that you'll give premature babies is a surfactant for underdeveloped lungs that will allow their lung cells, the alveoli, to increase to aid in the respiratory effort of, or the respiratory taxation of premature delivery. There's also another type of asthma treatment that are called mast cell stabilizers. They prevent the release of inflammatory modulators that cause bronchoconstriction. Um, Another type of asthma um, treatment is called a leukotriene agonist. Montelukast is an example of these leukotriene um, drugs. One of the unfortunate side effects of these montelukast receptor agonists are that they, for some reason, have been known to cause depression or depressive side effects in a drug called montelukast in your patients. Um, Another interesting comment about the long-acting beta agonist at like salmeterol. I don't know if you talked about this today at SIM, but it does have the ability to trigger growth delays. However, they're not typically permanent, and if these drugs are given to children for juvenile asthma, they may not only outgrow it, but they'll also catch up as um, they will also catch up gradually in the growth process as well before the growth plates close. Let's see, what else do we have to say about that? Um, the most important teaching for theophylline. Theophylline is another one of those drugs that are given for COPD. It's a beta 2 agonist. An interesting thing about theophylline is that chocolate is one of those, it, it can be. Chocolate is one of those drugs or one of those food substances that affect theophylline levels. Um, Also, cimetidine, the drug that we give for um, um, not GI. Amy, Dr. Starkovich, what's wrong? You have a sad face.
Chocolate is so delicious.
I know, but you don't really want to take it with theophylline, though. I know, I know. If I don't like chocolate, but if I did like chocolate, I would be sad. So
Oh my
I
gosh, it's a food
sympathize with
group for
chocolate.
me.
Yeah, there you go. Yeah, that's right. It's one step above fruit. Um, but also with theophylline cimetidine for upset, nausea, um, is also affects theophylline levels as well. And as you can imagine, you probably shouldn't smoke with theophylline or any other respiratory drug. Interestingly enough, though, smoking stimulates the metabolism of theophylline, and it may require your patient to get more theophylline. But once again, they should not smoke. Theophylline does, unfortunately, interact with a lot of over-the-counter medications. So always make sure you check with with the provider uh, or encourage your patient to tell the provider about any sort of over-the-counter drugs they may be taking in combination with their theophylline. So that's about all I have to say about these respiratory drugs, unless you have anything to add, Dr. Starkovich.
The only thing I would add is that codeine is considered an antitussive as well, which is something I don't remember learning in school, but
Yeah, it,
um,
yeah, it mutes um, the coughing centers, puts them to sleep,
yeah,
makes them
yeah,
lazy,
yeah. So it's really
makes them
good,
lazy.
especially for those patients who have been coughing so much they have heartburn. What did I just say? Chest pain.
Yeah, absolutely, absolutely. Alrighty, well, that's 54 and 55 in a nutshell. So we can certainly go on to do a exam review.
Yay.
Yay! That's exciting. All right, Michelle, you're in too.
All right, well, Let's go for it then, I guess.
Let's do it. Let's do it. So let's see. So we talked about antitussins, um, antitussive agents. Would you use them with caution in patients who have a history of addiction, even like codeine? Absolutely, you would. Absolutely, that's the right answer. That is the right answer. So I'll just run through these topics on upper and lower respiratory, just to get the ball rolling. So let's see. Let me find some other good upper respiratory. Asthma, I mentioned earlier. A mono. I can't talk. I've been talking all day. Montelukast drugs have a depressive side effect, and your patients need to be checked for depression. Um, we talked about beta adrenergic or for asthma exacerbation. They're used a lot like albuterol, basically because they're really quick. Um, and a lot of times you'll see it nebulized in the ER with either nebulized albuterol or nebulized rescue. Absolutely, they're rescue. The beta adrenergic medications are rescue. We talked all about certainly rinsing the mouth, especially with salmeterol, because it does have a side effect of thrush is one of the adverse effects of the medication if the mouth is not rinsed or oral hygiene is not done frequently when someone is on these medications. We talked about expectorants, of course, stimulating the excretion of um, respiratory uh, products of inflammation. Um, talked about TB and the rifampin as far as the side effect of or the expectation of yellow um, urine and other bodily secretions. Let's see what else. Um, we talked about the drugs used in TB and the orange color. I just said that. I'm repeating myself. We talked about as far as any sort of nasal um, drops or sprays. Always make sure we clear the respiratory system by blowing the nose um, and trying to clear the airways before we give the medication. As far as a beta 2 agonist, we talked about how growth may be slowed, but eventually adult height is reached. Typically speaking, children who are diagnosed early outgrow it. My middle daughter was diagnosed with asthma or um, potential asthma when she was 8. She outgrew it by the time she was 9, and a lot of times that's um, very much the rule instead of the exception. Like with anything, but particularly theophylline, patients should not use nicotine. It triggers the metabolism of the theophylline um, and will definitely alter the dose needed to keep the COPD under control. Also, watch out for taking chocolate with theophylline. Remember, all of these drugs that we take for asthma attacks, the reason why we take them is because we do want the bronchioles to dilate and allow the patient to have a deeper breath to inflate as much of the lung um, lobes as possible. Someone mentioned tachycardia earlier in the chat. Certainly, it's definitely a side effect of albuterol or those short-acting agents. Um, let's see what else. We talked about nicotine and theophylline because nicotine stimulates the metabolism of theophylline. Um, and as far as COPD um, and asthma, we use steroids to decrease the release of these inflammatory mediators, which is basically what what a steroid does is it decreases inflammation, and certainly uh, in the asthma and COPD, it's the mediators that are triggering these responses. As far as any sort of inhaler, particularly albuterol, we'd like our patients to take a deep breath out before you instill or before you give them a metered dose inhaler treatment. And then, of course, ask them to hold their breath after they inhale the medication to make sure they can their lungs can reach the maximum effect of the medication. Um, Indeed, albuterol is one of those rescue go-to drugs, and they're used quite extensively. You'll see it a lot, particularly simply because it's such a quick fix. Let's see what else. Da, da, da. I think that's about it. All righty, your turn, Dr. Starkovich.
Okay. So for our hormone replacement therapy, what is one concern we want to make sure, one lifestyle habit we want to make sure that our patients are not doing? If that question makes any sense. Yes, no smoking. So we want to make sure that our patients aren't getting blood clots or anything like that, any thrombosis with their hormone replacement therapy. What is a contraindication for metoprolol? Does anybody remember? So left-sided heart failure and metoprolol are no-goes, right? So if your patient has left-sided heart failure, we don't want to do metoprolol. I think it's contraindicated with metformin too. Is that correct, Dr. K? I believe that's correct.
That's correct. That's correct.
Yeah. So when we're giving a laxative or anything like that, what is a patient teaching note that we want to make sure we provide? Drink plenty of water. Yeah. Yeah, definitely
Right.
not for long-term use because you can get addicted to the laxative and not be able to have a bowel movement on your own. And you also want to look at your electrolytes as well, right? Because if we're giving ourselves diarrhea by drinking or taking all these laxatives, then we could be messing up our electrolytes. So we definitely want to watch for that also. Let's see. Also, I think that's about it with the laxatives. What about sucralfate? With sucralfate, it's kind of like that blanket for your ulcers in your tummy, right? So it's a nice little coat over those ulcers. So you want to take it about an hour before you eat. Yeah, it closes the potholes. So it's kind of protecting yourself a little bit. It's not an antacid or anything like that, right? But it's just kind of coating the stomach, and we want to make sure we take it about an hour before we eat. So that's a good thing to remember. That's a really good way to think about it, though, closing the potholes. Got our little ulcers going on there. Let's see.
One thing about the GI, Dr. Starkovich, is that anytime someone has, a lot of GI problems, particularly um, conditions where there's not a lot of peristalsis, you must use morphine with caution. I know morphine is one of those go-to pain relievers, but if your patient has a paralytic ileus, which means that their GI motility is very low, then morphine would be something that may definitely be contraindicated, because the last thing you want someone to do with low peristalsis or low gut motility is to give them a medication that will slow down their gut motility even further. Um, so I just wanted to mention that while we were kind of talking about GI stuff.
Yeah, definitely. And to go along with that too, Toradol or ketorolac is also contraindicated if your patient has ulcers in their stomach because it's an NSAID, and so it can definitely make that worse. Yeah, exactly correct, Michelle. So that's something else to think about also. You want to be really careful with Toradol,
Mhm.
ketorolac or Toradol.
What would you give your patient for too much morphine? What reverses morphine? There you go.
Right.
Naloxone. Absolutely.
Um,
Absolutely.
so what was
So what are
what
the
is
ACE? Go ahead, I'm sorry.
oh, that's right. I was just gonna say what is anaphylaxis since we're talking about a Narcan. I'm not sure why my mind went to anaphylaxis, but
There you go. Severe allergic reaction. That's okay.
yeah, a reaction that affects respiratory, and a lot of times it's going to be your airway closes, facial swelling. We're probably going to treat with diphenhydramine or Benadryl, steroid of some kind, Solumedrol. Prepare for intubation and potentially epinephrine as well. So very good due to immune response. Yeah.
There you go, for sure. And as far as other kind of drugs that are used to reverse um, overdoses, what is used to reverse an acetaminophen overdose?
It smells like sulfur. That helps any. And probably not.
That's it, Alice.
Phenylcysteine.
Very good. Very, very good. Let's see. There's antihypertensives on this drug. 100 questions. Do you remember any conversations we've had about ACE inhibitors? What are some things about ACE inhibitors that's very profound? A lot of people, and you'll have this next semester as well, cough. Absolutely. Monitor for a cough. And also ACE inhibitors, kind of segueing along what Dr. Starkovich said, as far as angioedema, a lot of the ACE inhibitors can cause swelling of the tongue as well. So we watch out for those things. In fact, when your patient, and you'll find this out next semester, if the patient begins an ACE inhibitor and they develop a cough, one of the main reasons why the provider will switch medications, uh, even though it's pretty annoying to have that dry cough, is the fact you could set them up um, for a severe response, an anaphylactic response, um, where the swelling of the tongue can be the next step before esophageal swelling. And we'll talk about that a lot next semester. Let's see. There's a lot of the beta blockers. One of the things you watch out about beta blockers is they can cause, what do they cause? What is side effect of beta blocker? and they're the OLOL drugs. They're given with caution because of orthostatic hypostasis, and we'll talk about beta blockers next semester as well. But they're given with caution, certainly in the elderly, for safety. But they have a tendency to drop blood pressure. So if your patient is started on a beta blocker, an OLOL, then and they develop low blood pressure, typically that's one of the reasons why those are changed as well. And it's actually called postural or orthostatic hypotension. Let's see, what else do we have? Um, One of the ways that we, when you give Medicaid, y'all are in clinical. Um, One is as far as the rights of medication delivery. You go through your rights, and then you always do 3 checks. When is your final check done when you're given medication? When is the final check done? At the bedside. There you go. Perfect. 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 Let's see. Sulfate, like Dr. Starkovich talked about earlier, it's given certainly for the potholes, but um, it also does relieve gastrointestinal pain simply because it's soothing and comforting. Um, let's see what else. Doody doo. Let's see. What's another? What drug don't you give with grapefruit juice? Calcium channel blockers. What's an example of a calcium channel blocker? There's a drug called verapamil that's a calcium channel blocker that you watch out for with grapefruit juice. And a lot of these medications for hypertension or antihypertensives we'll cover next semester as well. There was a lot of teaching in this exam content on nitroglycerin. Of course, anytime you give time release medications, and nitro has a version of a time release, um, obviously you don't. Yeah, you swallow it whole. Absolutely. What would be one reason why you would take a time release nitroglycerin? Chronic, absolutely chronic. So, if your patient has chronic angina and prevention, absolutely, you can prevent the chest pain, because when chest pain happens, it's because the vessels or the heart vessels are constricting. And anytime there's chest pain, prolonged chest pain can cause heart cell death. So you want to prevent, that process. So a lot of times these nitroglycerin um, uh, medications, particularly those that are like tablets, are to allow your patient to have quality of life and no chest pain. We talked about um, the sublingual ones. You take one every 5 minutes, right? And but you can expect headache because of the vasodilation. It can be given in the patch form, of course. Make sure the skin is clean and dry. One patch on, one patch off, one patch on. Don't leave two on at the same time. Wear gloves when you're giving it. A lot of times it's a paste that goes on the skin. Um, let me see. I know there's several other tidbits about nitroglycerin we can talk about, because there was a lot. Let's see. Usually they're put on in the morning. Um, traded out. Always know that you need to dispose of these patches appropriately. It's better not to flush them down the toilet.
They are flammable, so you want to make sure that you put them in the right box in
Absolutely.
the hospital.
Absolutely.
Mm-hmm.
Let's see. Sublingual tablets. Remember, we talked about um, they dilate the cardiac vessels, right, to allow more oxygen to be delivered to the heart muscles, the heart cells. Let's see. Don't flush them down the toilet. Let's see what else is about nitroglycerin. Remember, you can take up to 3, 5 minutes apart. Always call 911. Um, that's usually a safe bet, particularly if your patient is home alone. Let's see.
Yeah, and watch blood pressure too, right? So you want to be sitting when taking it so you don't get uh, hypotensive and pass out. That would be bad.
That's never
Or
good.
your patient, I guess.
Yeah. There you go, Michelle, knocking them out, burning them down, burning down the house.
Yeah, positive reinforcement.
There you go, man. You guys ready?
Yes,
Yeah, certainly. Yeah, Viagra too. Yeah, no doubt.
definitely contraindicated with Viagra. Make sure you look for those ED drugs or
Mhm.
ask about ED drugs before administering.
So, anytime you see smoking as an option, it's usually the right answer, especially the drug that we've talked about today. And interestingly enough, smoking is not a good thing. Um, and it even interferes with hormone replacement therapy, interestingly enough. So certainly, priority would be, smoking cessation. Let's see. Whatever works. That's absolutely, absolutely. So let's see. I think what else? We also talked about thyroid medications. This go a bit, right? So
Yes, that's correct. We talked about
so
that last
um,
week.
so when your patient has thyroid hypothyroidism, they have a deficit of TSH, right? Thyroid stimulating hormone. It's a negative feedback loop. We talked about thyroid hormones and how the thyroid stimulating hormone stimulates your thyroid. So if it's not working, it's because you have a deficit of the TSH. Let's see what else we have for the thyroids. Um, Let me look.
I don't think there's too much thyroid.
Yeah, there may not be too much thyroid on this test.
Yeah. Oh, yeah.
That
There's
may be
probably
it.
more, more hormone replacement therapy and estrogen
Then
receptor modulators. What is a main indication for using estrogen receptor modulators? What is a diagnosis that you would anticipate utilizing estrogen receptor modulators? We talked about last week. Yeah, postmenopausal osteoporosis. What about
let's
BPH meds? What are some examples of BPH medications?
Toxicin. Yep, that's one.
Mm-hmm. What else?
Finasteride.
It's like crickets. Proscar, yes.
Yep.
Okay, very good.
Finasteride for sure.
Mm-hmm. Um, and then one of them has teratogenic effects as well, right?
Absolutely. That's Proscar
Right.
for
Just be
sure.
aware of that. Yeah, or any female who is of childbearing age that may potentially be pregnant, right, with a male fetus. There are all kinds of criteria there. Oh, that's cute, Michelle. She remembers Proscar because it scars the male fetus. That's good. I like that.
That is nice.
Hmm.
That's
You
good.
got any more memory tactics there? So everybody wants to do study group with you, I guess.
Yeah, no kidding. I would. What drugs cause ringing in the ears? What drugs cause ringing in the ears? One of them is erythromycin, causes ringing in the ears. Aspirin causes ringing in the ears.
Lasix too, right?
Yep, absolutely. Lasix as well.
Pressure drugs. Yeah. And then what is another patient teaching for Lasix or furosemide? What is something that they need to I don't know, pay attention to? That's not what I want to say. We're in Texas, right? And so there's a lot of this in Texas. Oh, yeah, the sun is where
Sun
I was going.
exposure.
Definitely want some sunscreen and sun protection outside. But we probably want potassium with our Lasix because it's a potassium waster.
It is a potassium waster for sure. And anytime we do take any sort of diuretic, what is a kind thing to do when you give your patient a diuretic? When would you give it in the day? When is it kinder and gentler? In the morning, absolutely. So use the bathroom all
No, give
night.
it at night so they can stay up and pee
Stay
all
up
night
all
long.
night. That's right. Exactly.
Yeah. Same
Mm-hmm.
with BPH meds. Give it at night so they can stay up and pee all night.
Mm-hmm. Yeah. Another drug that causes kind of ringing in the ears is gentamicin. Gentamicin is one of those drugs that's not, it's a bad actor. It acts up with other drugs. It also causes tinnitus or ringing in the ears as well as dizziness. Bad actors, these guys. Bad actors.
What
And
about
speaking,
anti-diabetic agents?
oh yeah, here we go.
Yeah. Um,
Anytime you give them, monitor for hypoglycemia for sure.
yeah, and
Particularly,
with metformin, yeah, sorry, and
yep,
with metformin, there are a lot of contraindications, especially with contrast and things like that. So you have to be off of it um, for 48 hours before getting contrast. So that's an important thing to note for radiology tests.
yep, yep. Always monitor, particularly if your patient's going to surgery. They haven't had anything to eat, and they had somebody accidentally gave them their insulin. I've seen it happen more times than one. So always prioritize monitoring for hypoglycemia. And you would be surprised how easily that happens. Let's see. There was something else about, we talked about the tamsulosin as far as for BPH, and also these drugs also cause dizziness as well, BPH drugs.
Yeah, make sure you
Let's,
know the duration and the peak times for the different insulins as well. for your test. And do you ever mix Lantus with any other insulin?
No.
No. Yeah. And is it clear to cloudy or cloudy to clear when you're mixing? Clear to cloudy, yeah. Because it's okay to get a little bit of that short acting insulin into the longer acting one, but it's not so good to go the other way around.
Mhm.
Yeah. So,
How
those are
long
good
do you
things.
store insulin? 28 days. That's true. Dates, days. That's right. If your clear insulin is cloudy, you shouldn't use it, right? Maybe a little cloudy snuck in. Certainly don't use that stuff.
Yeah. And I like Michelle's comment. Lantis is like Atlantis. It's an island. It should not be mixed. It's
There
a
you
good
go.
one.
See, Michelle, you've got all these little nifty tipolas. NPH,
Um,
what does NPH peak at? How many hours? Oh, my Lantus. There you go. That's cute. When does NPH insulin peak? 6 to 14 hours. There you go. So
what
much mess.
type of insulin can you give IV?
Regular.
Regular, right. Only regular. Regular is the only one. Dun, dun, dun. Let's see, we already talked about aspirin and bleeding. How do you give eye drops?
In the eye.
Carefully, that's cute. Just poke them in the eye with the dropper, right?
Mm-hmm.
Works every time. Yeah, you don't want to touch the eye. Tilt the head back and drop in the you do the inner corner of the eye. You can also do the conjunctival sac. Have the patient look up and do the conjunctival sac, and then you can press the inner canthus or tear duct to prevent the tears from washing the medication out of the eye. And for how many minutes do you wait between each eye medication? I think the book actually says each drop is 5 minutes. Yeah.
Yeah, particularly with glaucoma drugs, because it has a tendency to affect your blood pressure.
You don't want to fill your inner canthus too high either. So it
Yep.
does sound like forever, but if you're giving a bunch of meds, you could plan that out. First med at the beginning, let's give your other meds, and now let's drop again. There you go. It's probably been 5 minutes.
That's actually clever. You've done that before. It sounds like you've done that before.
Yeah. Otherwise, you sit and chat for a while, which your patients typically don't mind that either. So,
Mm-hmm. Yep.
but not very efficient. For verapamil, what dietary teaching would you provide with verapamil?
Grapefruit juice.
Mm-hmm. And then it's got a side effect of constipation as well, right? So you want to increase fiber also. What else? Did we go over everything?
No, we got a little bit more to go. Um, there's a drug called Nardil, phenelzine. What's an interesting thing about that drug? Do you remember from talking about it in our previous gatherings? A lot of interesting responses. No, that's right. No aged meats, cheeses, or pickled things. Absolutely. Absolutely. Like salami, anything that's aged or pickled. Absolutely. Absolutely. What about, we talked about antidepressants. Um, Certainly, antidepressants can cause dizziness as well, nortriptyline in particular. Your patients should always rest or um, go from sitting to standing, not quickly. Um, as far as fluoxetine teaching, a lot of these antidepressants will decrease sex drive, which is why which is one sex decrease of sex drive and weight gain are two of the biggest reasons why people stop taking antidepressants. Um, one thing about these SSRIs, you have to watch out because your patients could slip into serotonin syndrome, and certainly that can be catastrophic. Um, One of the most um, alarming side effects of serotonin syndrome is airway, um, is respiratory depression to the point of your patient may need mechanical ventilation. You'll learn next semester uh, drugs that natural over the counters like St. John worts, if they're taken with SSRIs, they can actually trigger serotonin syndrome. So that's just a tip for next semester. Hope to
And
see you
St.
next
John's
semester.
wort is contraindicated too with hormone modulators as well, I believe.
Absolutely. It is for sure.
Mm.
Um, let's see. As far as we talked about Nardil, no salami, no aged cheese, but also it has the effect of drowsiness. So Nardil is phenalzine, and you should also treat that like a drug that can cause orthostasis, so get up slowly. Um, One of the fluoxetine I mentioned earlier, it also has a side effect of rash. So always check your patients for rash as well. Um, let's see. Antidepressants, unfortunately, can take several weeks to kick in, but you should never stop taking them cold turkey. Always your patients should go to their prescriber before discontinuing them. Usually, um, they have to discontinue slowly, not cold turkey. Um,
Same with
a lot of these,
baclofen.
excuse me.
Sorry. I was just saying, same with baclofen. You never want to stop at cold
Absolutely.
turkey either. Because you could have seizures, things like that. And then if you take with alcohol or even antihistamines, it can increase your sedative effects.
Mm-hmm. Mm-hmm. Let's see, I think there's a couple more on antidepressives. Like if somebody, obviously, if somebody takes an overdose of any sort of antidepressive drugs, they certainly need to go to the emergency room. particularly amitriptyline. That particular drug has a high serum concentration and can certainly damage your liver as well as your kidney, where they're excreted highly in the kidneys. Um, let's see, antidepressants should also be taken first thing in the morning. Um, let's see, a lot of your lipid medications should be taken after any other medications. Lipid medications should also not be taken while using tobacco. Um, hypercholesterolemia drugs, certainly adverse effects other than gastric are also weakness. These drugs were not intended to take forever. Actually, these modulators were invented or developed to help someone um, develop a healthier lifestyle to include diet and exercise. However, most people, like my husband, start taking it and then they just think that's a ticket to eat whatever they want, like fried foods, etc., etc. Unfortunately, that's not the case. It's always better to take them. Uh, why would you think you shouldn't take them with other medications? You just shouldn't. Just kidding. Just don't do it. Let's see. Let me close the loop on some of these things. Do nifedipine. Anytime your patient is on antihypertensives, what's one thing you're going to always check on them? What's one vital sign you're going to always check on them? Blood pressure, absolutely. But at least blood pressure. One of the mainstays of one of the first go-to um, on hypertension, uh, particularly newly prescribed hypertension, is a drug called hydrochlorothiazide. What does hydrochlorothiazide do? What is the mainstay of hydrochlorothiazide? It's for essential hypertension, which means it's just of no known cause. There's secondary hypertension, which can be attributed to diabetes, any other sort of chronic disease, but primary or essential hypertension, your go-to is going to be something that's just going to drop some of the fluid out of the body, hydrochlorothiazide. But what's one of the side effects of just diuresing? What goes with water? Yep, absolutely crampy. They get real crampy, particularly leg cramps for some wonderful reason.
Salt
I
goes
think
with
we
water.
yay. Yay. Remember atorvastatin and grapefruit juice is not a good combination. Um, let's see, if somebody's allergic to penicillin, one of the things that you may not want them to take is amoxicillin and clavulanic acid, that combination perhaps. Um,
Is that the
just kind of,
Cipro as well? Or is
yes,
that,
ma'am.
yeah.
There you go. Let's see. We talked about cephalosporins. If you have which is a Cipro and penicillin, you want to make sure not so much anymore, but it's always the outside chance that if you're allergic to one, you could be allergic to the other. Um, let's see. Remember that morphine. What do you monitor with morphine? Anytime you give morphine, what are you monitoring? What respiratory rate?
Yeah.
Absolutely, absolutely, absolutely. Um, anytime you have an antibiotic, your patient is on an antibiotic. Um, certainly, particularly if you're giving antibiotics to a child, always make sure um, the patient's mother or caretaker has been given adequate written information about the drug, um, any adverse effects that the drug may cause, and certainly the reason why um, anyone is taking the medication. Patient teaching includes the purpose of the medication, the purpose the medication is ordered, any adverse effects that you might see, and certainly one of the new um, things, and probably Dr. Starkovich can speak to this more so than I can, is there's several patients have different learning styles. Some people learn better when you explain things, and other people have to actually read it. So when you discharge your patient from a hospital, you're going to provide literacy level written information. Certainly literacy, medical literacy is certainly on the forefront of teaching, patient teaching. Remember, NSAIDs usually are given with food. Why? Why are NSAIDs given with food? GI upset. Absolutely. 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 We did talk about patients going home with angina. What would happen? How did Elvis Presley die? Do you remember?
Coronary on the toilet.
Yeah, on the toilet. Absolutely. So if your patient has angina, or uh, you always want to make sure they have an increase. He basaled out. That's right. You want to make sure. You're right. This is the go-to for all the good stories. I mean, Farm One. We should have, what is it? The students of Farm One, kind of like the wives of Orange County.
Yeah.
We could have the students of Farm One. But certainly make sure your angina patients have plenty of fiber so they don't have to bear down on the toilet. Farm One, real talk. I'm liking it. I'm liking it. I'm liking it.
We can have a podcast.
Yep, that's right.
Who needs a nursing school? We'll just make money on a podcast.
Yeah, no
You don't
kidding.
really want to be a nurse, right?
So what's omeprazole? Yep, absolutely. And the main purpose of these drugs is to reduce stomach upset or dyspepsia. Make me remember, when you take anything for the lower GI like glucosate, always make sure you take lots of water in with it. Your guts can't work unless they're lubricated. Water is the best thing to keep all the pipes clean. Um, let's see, sulfate, we talked about taking that um, before meals and at bedtime, basically because you're protecting the stomach, certainly through the night when your stomach doesn't have food in it and the acid may be um, at an all-time high. Remember, aspirin can cause bleeding, so always watch out for bleeding, and especially GI bleeding too. Um, Anytime aspirin is given for anything, particularly arthritis or any rheumatoid arthritis drugs, always check to see if they have a history of gastric ulcers. Um, let's see, vancomycin. We talked about, well, any drug you give IV, if it's certainly toxic to the veins. IV vancomycin is one that are really hard on the peripheral veins. Certainly, particularly in the elderly, you need to um, give it slowly or reduce the infusion rate if you need to save the site. Um, let's see. The two types of we need to remember insulin glargine. What's insulin glargine? Slow, medium, fast? What? Long. There you go.
Yeah.
18 to 24 hours for sure. Let's see. We talked about Nardil or phenylzine in salami. What a weird combination. Talked about albuterol for rescue. Let's see. There's a couple of Vanc questions. Vanc and nephrotoxicity. We'll talk about that next semester as well. No, will we? I might have just told a lie. I don't think we talk about that next semester.
Well, the
But
interesting thing about vancomycin too, and I don't think this is on your test, but IV can cause C. diff, but the treatment for C. diff a lot of times is oral vancomycin. I always think that's interesting.
that is farm talk, real talk. Let's see. There's some dosage questions on here, so and they're pretty straightforward. Let's see. Liver function test. Atorvastatin. Atorvastatin hates your liver. A lot of drugs hate your liver, by the way. I'm just gonna say. We'll talk about a lot of those next semester as well. Bad actors, man. They're all bad actors. Let's see. Documentation. Let's see. Yeah, what? I think it's one of the questions has to do with monitoring licensed personnel as the RN. There will be management questions on your NCLEX, supervision type questions. Always make sure. Um, Always make sure you and no one else that you're monitoring or that you're responsible for document medication prior to administering it. Now, I've seen this done in practice.
Yep.
I was a house
Yep.
supervisor and I've been on a sentinel event, and don't document it before you actually give it. That's a big
And always
jumbo.
document your follow-up. Always document your follow-up. I know I'm chair of nursing peer review, and that's what we're always looking at is somebody died or had an adverse event, and nobody documented follow-up after the medication. And it's like, well, there's no proof that you provided appropriate nursing care. So it's very important.
Yesterday.
Yeah. Yeah. So if you learn anything, at least learn that. When you give a med, always document your follow-up within the allotted time, which is usually an hour unless it's pain medication or a sedative or something like that. It could be 15 minutes.
All right. Well, real talk is about to come to an end. Does anybody have any real questions? So first of all, I just have to know, how much are all of you going to miss us? Man, no chat. Oh, there you go. Thanks, Michelle. Whew.
They're not going to
Thanks,
miss you because they'll probably see you next semester.
Yay!
I mean, they barely interacted with me, so they'll probably not miss me at all.
That's not true, Dr. Starkovich. Don't say that, Dr. Starkovich. It's not true.
Yeah.
Yeah, you do have
See,
me,
look,
Sabina.
you got all these people next semester.
Sabina, honestly, do you know already? I had to pay him $20 to get you in my class.
Yeah, they said in the orientation yesterday that the students have their information, but it's not set in stone yet. Their schedule, but it's not set in stone. And it might change.
Yay. Hip hip a yay. Woohoo! I'm a winner. Chicken dinner.
There you go. You don't have to get used to a new instructor. How exciting!
That's right. You already know the straight talk and Pharm 1 straight talk turns into Pharm 2 legit talk.
Dr. K will let you in her class regardless.
Heck
So all you gotta do is
yes,
email
heck
her.
yes.
She'll
Hey,
send you
but
a link.
hey, but guess what? On Cynthia, on other news, yeah, here you go. www.fun.com. Um, so
Exclamation
by the
point.
there you go. Yeah, there it is. But here's the deal. There's another instructor called Professor Padilla, Selena Padilla, and she and I do the same thing together that oh, she's amazing. She and I do the same thing together that Dr. Starkovich and I do. We have class together. So even if you don't directly have me as your instructor, you will still steer. I can't even talk. Yeah, you, Victoria, really like her. She is super, super, super cool. So yeah, so I'm tagging along with you guys through the program at least another semester. So So yeah, we'll have a really good time. Professor Selena is she's legit for sure. She'll do the legit talk in Farm too. So anywho, so we have about run out of straight talk, unless there's any straight questions. Where's
Yeah, thanks
Michelle?
for
Michelle, where
staying
are
some
you? Did the
extra.
babies go to bed? Yeah, get the babies.
What? So sad. What is
They might be
neurology?
sleeping.
The fourth grader's working on a final draft of her paper that's due tomorrow. So she's back there writing.
Oh, boo
I don't
Lord, you
homework.
want
started
to
too
Boo
early.
homework.
I don't want to interrupt her, sidetrack her.
No kidding. Don't break the spell. Don't break the spell. All righty. Well, Dr. Starkovich, you want to jump in with a prayer?
Sure.
Yeah, we'll write it for her because we need her to pray. Are you kidding?
Yeah, what's it about? I just finished a paper yesterday, I mean, I'm in paper mode.
Yeah, no doubt. I'm always looking for somebody to write mine. So how about Millie? You want to say a prayer, Millie? Mm-hmm. Mm-hmm. Hold out for prayers. Oh, you have screaming kids? Yeah, I know. My kids are still screaming and they're 30 and 29.
Me too.
Well, let's see. Little one is two. Oh, goodness gracious. Yeah, I had little kids in school too. In fact, I had a baby in nursing school. Man, who does that?
A lot of people.
Yeah, it was a surprise.
I know a lot of people who've had babies in nursing school,
Yeah, I was
and
like,
then
what
they've
did
only
I
taken like
do?
a week off because they're like, nope, nope, I can only take a minimal amount of time.
Yeah, I had to come back for that test. Four
Wow,
kids with the
Paige,
youngest
that
one out. You
sounds
win the
mega
prize.
stressful.
You definitely win the prize, Paige. Yep. All righty, so here we go. I could chat with you guys straight up talk all night long, but we'll let you go because the kids got to go to sleep. But dear God, thank you, thank you, thank you, thank you for this day. Thank you for this gathering. Thank you for the gift that Dr. Starkovich and I have to be your mentor, to be a part of your nursing journey, and to be able to lift you up every evening in our prayers when we wish and pray peace, um, wisdom, and certainly program completion over each and every one of you. One day, very soon, you will all be our colleagues, and you will join a very united, amazing profession where you will get to literally witness miracles. Healing is definitely a miracle. God's love and grace is a miracle. And so we go together united for those common, for that common good to all that God will place in your lives. Um, we lift you up through this, not only through this exam, but the rest of this semester and the rest of the program. We pray that you and your families and all of your children, of course, are safe and happy and live to be a very loving, long life. Um, we pray for world peace. We pray for the end of the pandemic. And we lift up our voices and pray together in the precious name of our Lord and Savior, Jesus Christ. Amen.
Amen.
All righty. Good night,
And Alex,
everyone.
you're so encouraging. That's so nice to have somebody.
I know, man. You guys are so neat. This is a really neat group of people, and it's certainly all right. We have a hand up. She is a rock star.
Oh,
Accident.
okay.
Oh, okay. All right,
We're all
everyone. Well, we
excited.
need to let you get off to bed. But if y'all need anything, thank you, Jasper. If y'all need anything, reach out. We're always here for you. Always, you're in our thoughts and prayers. And certainly, we'll have I don't know. We don't have anything to get together anymore, right? Oh, no. Oh, no. Oh, no.
No,
All righty.
I don't want to put it out in the universe or anything, but the final will go great.
Absolutely. Axe
Ooh,
throwing
axe
after the
throwing is
final.
so much fun.
Yeah. I just burned my scrubs. I did something boring like burning my scrubs when I finished nursing school. They made us wear white.
Really? Mine are still
White.
hanging in my closet. Well, only the tops. I got rid of the bottoms, but
I'll leave that one alone because it's time to go to bed. All right. Good night, everyone. Y'all have a good evening. Bye.
bye.